This morning, Stephen Edwards is the CEO at Cox Health in Missouri, and Dr. Alan Kaplan is CEO at UW Health in Wisconsin. Talk about some of these logistic rollouts. Gentlemen, thanks for the time. Good to see you both.
Glad to be here.
Stephen, pretty remarkable weekend when you think about it. You had the COO, a general, U.S. general, apologize for what he said was a slower than expected rollout of at least the Pfizer vaccine. Has it felt that way where you are?
Well, we're anticipating this. It's all like a Santa tracker for us. We understand it's coming today with Moderna. We have about 7,000 coming that will begin to care for our 12,000 plus employees. So we're excited about it. We're ready for it. We'll probably, if it arrives in time, do our first dosing this evening around 5 p.m., just as the sun starts to set. We love that the Christmas star will be first visible tonight. That symbolism will be powerful to us. 800 years, it's never been this bright. So that's a powerful symbol for our staff right now.
Dr. Kaplan, I'll ask you the same question. How has it felt on the receiving end? And is there a sense that the Moderna vaccine, with its easier refrigeration standards, is going to make that even easier?
We were very fortunate. We received 3,800 Pfizer vaccines last week on Monday. By end of today, we'll have vaccinated 1,700 employees. We're ramped up now to do 300 vaccinations per day. Starting tomorrow, we'll be up to 600 vaccinations a day, and we're looking forward to get that Moderna supply.
Stephen, one of the conversations we've been having on our air, including with other executives from hospital systems around the country, is the fact that there are a number of healthcare workers out there, not to mention the general public, who don't necessarily want to get the vaccine or one of these vaccines, at least to start. What are you seeing within your own employee ranks right now? And as you do start to administer the vaccine, how are people reacting to it physically?
Yeah, great questions. So we've been able to look at an analysis of the signups for our employees, break it down kind of by demographics. That's what you might expect. Our more rural hospitals, we have the lowest percent of interest. The higher the educational level, more professionalism. Our physicians, for example, are 95% signed up. And so we're seeing some people that have a little less understanding of science with more reluctance. And that's fine, because we want our frontline caregivers to get it first, and then it'll work its way down to the frontline, workers that aren't patient direct. And so, we think this number will grow. And Moderna was really just finally approved Friday and Saturday. And so there's some that are careful, and I understand that. I think some of our younger female employees want to hear a little bit more about the safety data for fertility issues, and I think a lot of that's been debunked, but they're watching that. But we already have about 3/4 of our slots filled, and as the day goes on, we'll have more slots filled. So we have about 5,000 signed up, and we expect another 1,500 sign up by the end of the week.
Dr. Kaplan, don't want to forget, though, unfortunately, we still got this pandemic raging throughout the country. Your state has been pretty hard hit, although I think things are looking a little bit better. Can you give us an update from what you're seeing on the ground?
So you're correct. We were hit hard in the fall peak, and mostly in November. We're starting to come down off the November peak. But having said that, we have twice as many hospitalizations than we did last spring. Things are looking better, but we're still on guard. We still got to get through the holiday season, and we've seen these peaks come and go. So things are better, but we're prepared should they start to peak again.
Shepard Smith here. Thanks for watching CNBC on YouTube.